Primary hypertension is called the silent killer because most patients have no symptoms to alert them to elevated blood pressure. It is a gradual process, so over time, high blood pressure increases the risk of serious problems such as stroke, MI, or heart failure. However, sometimes if the blood pressure rises suddenly, then it will present with symptoms such as headache, visual disturbances, nausea and vomiting, and confusion due to end organ damage. Blood pressure is measured with a device called sphygmomanometer. It has three parts: a cuff that can be inflated with air, a manometer for measuring air pressure in the cuff, and a stethoscope for listening to the sound the blood makes as it circulates in the brachial artery. To measure the blood pressure, the cuff is placed around the upper arm and then inflated at least 30 points above the normal systolic blood pressure until no blood can flow through the brachial artery. Then the air is slowly released out of the cuff. As soon as the pressure in the cuff falls below the systolic pressure in the artery, blood will start to flow through the arm once again. You can listen to the patient's heartbeat due to this inrushing blood. Note the reading when you first hear the heartbeat. That's the systolic blood pressure. And note the reading when the heartbeat sound disappears. That's the patient's diastolic blood pressure. It is important to measure blood pressure more than once because it fluctuates over the course of the day. Physical exertion, stress, pain, or extreme heat or cold can affect blood pressure. Also, in a subgroup of patients, the blood pressure rises to almost 20 millimeters of mercury whenever they enter in a clinical setting, so-called white coat hypertension. If we just rely on clinical readings, then such patients will be diagnosed as having hypertension when the vast majority of times their blood pressure is normal. Due to these reasons, NICE guidelines in 2011 introduced the use of ambulatory blood pressure monitoring and home blood pressure monitoring. Ambulatory blood pressure monitoring, or 24-hour blood pressure measurement, is just the same as the normal blood pressure check. It is a digital machine that takes the blood pressure by inflating a cuff around the upper arm and then slowly releasing the pressure. The machine is very small. It can be worn on a belt around the waist, while the cuff stays on the upper arm for 24 hours. The machine will then take blood pressure readings at regular intervals, usually every 30 minutes during the day and every 60 minutes during the night. At the end of the 24 hours, the machine will have stored all the readings, and these readings will then be analyzed by the doctor. If the ambulatory blood pressure is declined by the patient or not tolerated by the patient, then we can advise them to measure blood pressure at home twice daily for 7 days. For each recording, there should be 2 consecutive measurements, and after 7 days, we discard the measurement taken on the first day and use the average reading of the remaining measurements. Now, how do we interpret these results? For that, hypertension is divided into stages. Generally, clinic BP of more than 90/60 and less than 140/90 is considered as normal. But if it is on the upper limit of the normal range, then we can call it as pre-hypertension, which can be treated with lifestyle measures alone. When the clinic BP is more than 140/90 millimeters of mercury, and subsequently the ambulatory blood pressure is more than 135/85 millimeters of mercury, then it is called stage 1 hypertension. In stage 2 hypertension, the clinic BP is more than or equals to 160/100, and subsequently the ambulatory blood pressure will be more than 150/95 millimeters of mercury. Stage 3 hypertension is severe hypertension. It is defined as the clinic BP of more than or equals to 180/110 millimeters of mercury. At this level, we do not need to do ambulatory blood pressure to confirm the diagnosis. Instead, it should be treated immediately. Severe hypertension is divided further into 2 types: hypertensive urgency and hypertensive emergency. In urgency, the blood pressure is high, but there is no end organ damage. That means the patients won't present with any symptoms like visual disturbance, nausea, vomiting, etc. This can be treated with oral treatment in the outpatient department. But in emergency, however, patient will have symptoms of end organ damage. These patients should be admitted in the hospital and they should be treated with IV antihypertensives like sodium nitroprusside or labetalol. Sometimes patients have high systolic blood pressure or high diastolic blood pressure alone. This is called isolated systolic hypertension and isolated diastolic hypertension respectively, but the treatment remains the same whether hypertension is isolated or not. This is the summary of whatever we have studied up till now. If the clinic reading is more than 140/90, we offer the patient ambulatory blood pressure monitoring or home blood pressure monitoring. If the average blood pressure is less than 135/85, it is considered normal. If it is more than 135/85, it is stage 1 hypertension, and if it is more than 150/95, it is stage 2 hypertension. Stage 1 hypertension is treated if the patient is less than 80 years and has end organ damage or any associated risk factors like diabetes. So we treat them with oral antihypertensives. For patients who are more than 80 years old, for them stage 1 hypertension is diagnosed when the blood pressure is more than 145/85. In stage 2 hypertension, however, we treat all the patients regardless of age. Management of hypertension is divided into two categories. First is lifestyle advice, which is very important, so it should not be forgotten. The patient should reduce salt in their diet, aiming for less than 6 grams per day, ideally 3 grams per day. Caffeine intake should be reduced, and the other general bits of advice remain: stop smoking, reduce alcohol consumption, eat a healthy balanced diet, and exercise 30 minutes a day for at least 5 times a week. The second category is pharmacological treatment. According to NICE guidelines, for people who are less than 55 years and who are not Black, ACE inhibitors are first line. ACE inhibitors block the ACE enzyme and inhibit the formation of angiotensin II, which is a vasoconstrictor. In this way, there will be vasodilation, leading to reduction in blood pressure. The first-line treatment for people who are more than 55 years of age is calcium channel blockers. This is because the activity of renin-angiotensin system declines with age. Also, Black people, regardless of their age, respond well to calcium channel blockers than ACE inhibitors. The exact mechanism of these differences is still not fully understood. Normally, calcium is responsible to contract the vessel smooth muscles. So if we block these calcium channels on the smooth muscles of the vessels, then the vessels will relax and the blood pressure will be reduced. If monotherapy fails to control the blood pressure, then we use a combination of ACE inhibitor and calcium channel blockers. If this still fails to control the blood pressure, then add a thiazide diuretic, which will increase the excretion of sodium and water by the kidneys, decreasing the blood volume and therefore decreasing the blood pressure. Despite triple therapy, if the blood pressure is still not under control, then it is termed as resistant hypertension. Consider expert advice at this stage and look at the potassium levels. If the potassium levels are less than 4.5 millimoles per liter, then add spironolactone, which is an aldosterone receptor antagonist. If the potassium levels are more than 4.5 millimoles per liter, then consider increasing the dose of thiazide diuretics. If further diuretic therapy is not tolerated or is contraindicated or ineffective, then consider adding an alpha blocker or a beta blocker. By blocking the alpha receptors on the vascular smooth muscles, norepinephrine will not bind to the smooth muscles, which is a vasoconstrictor, so the vessels will dilate. Beta blockers block the effect of catecholamines on the heart. In this way, they reduce the force of contraction of the heart, subsequently decreasing the blood pressure. That's it for today, guys. If you liked the video, then please share it with your friends. Follow me on my Instagram page and subscribe to my YouTube channel. Take care. God bless you all.